Bismillahirrahmanirrahim. Assalamu alaikum. Do you always feel tired? No matter how much you sleep, and your whole body feels like it is been through a workout, even if you haven't done anything strenuous. If yes, you may be suffering from fibromyalgia. Well, today I want to talk about something millions of people deal with every day: fibromyalgia. And I will explain it through a case history. Meet Parveen Bibi. Parveen Bibi is a 35 years old school teacher who has been feeling off for years. She says, I'm always tired no matter how much I sleep, and my whole body feels like it is being through a workout, even if I haven't done anything strenuous. Looking at her symptoms, number one, there's a chronic widespread pain. Parveen Bibi feels pain all over her body, especially her shoulders, back, and hips. The pain is dull and constant, lasting for months. Second symptom is that of fatigue. She wakes up feeling unfreshed and struggles to get through the day, often taking naps in the afternoon, but still feeling drained. Third type of her symptoms is cognitive fog or fibrofog. Parveen Bibi has trouble concentrating, forgets things easily, and feels mentally slower than before. Fourth type of her symptoms is sensitivity to stimuli, bright lights, loud noises, and even mild touch can sometimes feel overwhelming or painful. Other symptoms, she also mentions headaches, IBS, that is irritable bowel syndrome, and difficulty sleeping. Journey to diagnosis. Parveen Bibi's journey has been frustrating. She visited several doctors and underwent countless tests for arthritis, thyroid problems, and autoimmune diseases, all of which came back normal. Some even suggested it was all in her head. Finally, she visited me for her aches and pains, NSAIDs-induced dyspepsia, and IBS-like symptoms. I carefully listened to her story and performed a detailed physical examination. I explained to her that her symptoms matched fibromyalgia, a condition that causes changes in how the brain processes pain signals. So, what causes fibromyalgia? I explained to her that while the exact cause isn't fully understood, possible triggers include stress or trauma. Parveen Bibi had a car accident 2 years ago, sleep disturbances, and family history of fibromyalgia. The management plan. The management plan included education. Understanding the condition was a key part of her recovery. Second, I suggested lifestyle changes, gentle exercises like yoga, improved sleep hygiene, and stress management. Medications also, I give her low doses of antidepressants and pain modulators to help manage her pain symptoms. And of course, the cognitive behavioral therapy to help cope with the emotional aspects of chronic pain. So, Parveen Bibi today, with consistent effort and support, Parveen Bibi has learned to manage her symptoms better. It's not easy, she says, but understanding my condition gave me the tools to take control of my life again. So, fibromyalgia is a chronic condition characterized by widespread muscle pain, fatigue, and tender points. The symptoms, when we look into it, these include widespread pain in the back, neck, shoulders, hip, and legs, fatigue, sleep disturbances, cognitive difficulties, memory, concentration, headaches, irritable bowel syndrome like symptoms, restless syndrome, sensitivity to light, sound, and temperature, morning stiffness, and difficulty with physical activities. The diagnostic criteria for fibromyalgia has five main components. The first is widespread pain for 3 to 6 months. And there should be tender points, 11 out of 18. We know that the doctor knows what are those points. Then sleep disturbances, fatigue, and cognitive difficulties. All these five make a diagnostic criteria for fibromyalgia. What are the treatment options? These include medications and non-pharmacological. In the medications, these include pain relievers like acetaminophen, ibuprofen, antidepressants like amitriptyline, fluoxetine, sometimes anti-seizure drugs like gabapentin, pregabalin, and muscle relaxants like cyclobenzaprine. In the non-pharmacological therapeutic options, there is exercise, low-impact aerobics and yoga, cognitive behavioral therapy, stress management, meditation, deep breathing, sleep hygiene, the physical therapy, acupuncture, and massage therapy. Lifestyle changes are equally important to combat the fibromyalgia, and these include regular exercises, balanced diet, stress reduction, sleep schedule improving, and relaxation techniques. What are the alternative therapies? These are chiropractic care, herbal supplementation at times, turmeric, ginger, mindfulness-based stress reduction, biofeedback, and hypnotherapy. So, the fibromyalgia is not uncommon. It's a common medical condition which frustrates the patient, and at times it results in huge economical impact in terms of the investigations, in terms of the visits to the doctors, and of course, in terms of the taking medications. So it's very important if you feel from a chronic fatigue, aches and pains, it's important that you visit your doctor, that he or she takes full history of yours, do the relevant examination, listens to you, and if you are suffering from fibromyalgia, so make the correct diagnosis and help you out how to cope with your fibromyalgia symptoms. I end here. Thank you very much for being with me. If you have got any questions, any comments, please do ask in the comment section and I will try to answer that. So see you in the next vlog on another health topic. Till then, take care. Khuda Hafiz.